Hurley from the CFHS. She will be doing part of the webinar as well. This is, as you know, the Million Cat Challenge. This webinar today is exclusive to CFHS members. We're very excited to be doing the Million Cat Challenge in Canada. Our goal is going to be 100% involvement of CFHS member shelters, which is incredibly exciting. I just can't believe that we're doing this here in Canada, that this is the actual program that's come here, which is fantastic because, you know, as a Canadian, we're usually at the end of the line to get these phenomenal things that come up from the U.S. I wanted to let everyone know that your microphones right now are going to be muted. We're muting everyone to cut out that ambient noise. At the end, if you have questions, what we'll do is we'll get you to type in your questions, and Hillary will read them out, and Kate will be able to answer them. Additionally, we do have PDF versions of the of the presentation itself, and the webinar is being recorded. So there will be some additional resources at the end, or if a slide goes by quickly, don't worry. You know, there will be that opportunity that you will have a copy, a PDF copy of the slideshow itself. So without further ado, I want to introduce Dr. Kate Hurley. She is the director of the Court Shelter Program down at UC Davis in beautiful California. And we're very fortunate to have her here doing the webinar. Kate, I'm going to turn it over to you.
Thank you. And I feel very fortunate to be able to talk with you all today, and thanks for taking some time out of your busy schedules. Canadian shelters have played a disproportionate role, given your numbers, in really establishing the initiatives of the Million Cat Challenge, and in particular the sort of central initiative, Capacity for Care. So great to have you all here, and we'll talk more about our plan for having 100% participation from CFHS shelters, which would be an amazing way to lead the way for North America. This is a quote that I ran across when the Million Cat Challenge had first arisen as a twinkle in me and Julie Levy's eyes, my co-conspirator on the Million Cat Challenge. And it seemed like an audacious goal to save 1 million cats in North America. And I saw this quote, I saved it on my iPhone, and I thought to myself, when the Million Cat Challenge is real, and it's funded, and it's actually happening, I'm going to dust off this quote, and I'm going to use it. And that was about 1.5 years ago, not that long ago. And what's interesting is that just in the time since then, this has risen from a whisper to a shout, and it's become much more than something we're just going to give a try. It's something that's actually being done. It's been implemented. It's been proven in shelters across North America of every size, of every type, from old buildings to fancy new buildings, from small to big, from urban to rural. And the really great news is that we're realizing we don't even have to have some big argument between our hearts and our reason. These programs are not only kinder for cats and for us, but they're also practical. They're grounded in data. They're grounded in science. And we still have a lot of work to do. We have groundwork to be laid. We have resources we need to invest to make this possible for every shelter in every community across North America. But the fundamental barrier, really the greatest obstacle standing between us and actually making this a reality, is just the belief that it can be done. So I'm not going to go into tons of details about the how for each initiatives in the Million Cat Challenge today. That will be the resources that will be available on our website and to the participants in the Million Cat Challenge that we will build and help each other develop over time. But today I want to encourage you to just believe this is absolutely attainable. We can do it. Maybe we can't do it all at once, And this has been a hard lesson for me to learn. This is me when I was 24. I was an animal control officer at the Santa Cruz SPCA. I was carrying that little cat in a carrier, and the way I saw myself was super officer, protector of all cats. And I thought that by picking up that cat and bringing her into my shelter, even though only about 1 out of 4 cats left that shelter alive, even though the conditions of care that we could provide weren't that great, even though a lot of cats got sick, and sometimes when they got sick, they got euthanized, I absolutely believed I was doing the very best that I could to protect cats, to protect wildlife, to protect public health, to get cats into good homes, and to solve the feline overpopulation problem in my community. But here's the thing that I've come to painfully realize over the subsequent 25 years and have to learn over and over again. There is a limit to what our superpowers can control. And when we try and exceed what we really can do, we actually become less effective at serving any of those important goals that we all share. So, can we control whether people are allowed to have cats, whether they're allowed to feed cats, no matter how strict our policies might be about who can adopt from us or what laws we might try to pass? Can we decide that? I think you know the answer to that. And can we control whether there are free-roaming cats in the world, causing risk to wildlife, creating a public health hazard, incurring risks themselves, suffering injury, suffering cold, suffering from hunger? Can we control that by trying to round them all up and bring them into shelters, exceeding our capacity for care, sometimes exceeding our capacity to assure a live outcome for every cat? We can't. We can't control that. Here's an image that's just emblematic of the limits of our superpowers. We might have restrictive adoption policies. We might set our fees wherever we want to set them. We might require landlord permission. We might require a long application process. But anyone, any day of the week, can turn to Kijiji. They can go to the grocery store and get a free kitten from a box of kittens. They can get a cat from their friend or their neighbor. If people want a cat, they're going to get a cat. The only thing that we might be able to do is steer people towards shelters as a source of spayed-neutered, vaccinated, identified cats, and start to build relationships with people so that if they do get a cat and they run into trouble, they know that they can turn to us. And this is just another way of looking at the limits of our superpowers. This is the source of cats in Canadian households, and this is actually very similar to data on the source of cats in U.S. households, where shelters own about 1/4 of the piece of the pie. And so that tells us we don't get to decide who gets cats, who has cats in our world. But it also gives us some encouragement that we can share the burden, that just because a cat doesn't come into our shelter or doesn't come into our shelter today doesn't mean that it's not going to get rehomed. In fact, if we bring it into a shelter that's overcrowded or where a cat is going to have to be euthanized to make room for another cat, or as a result of the overcrowding that occurs, the cat's chances of being rehomed may be better if it remains in the community where it is, or if it remains in a home where it is, and especially if, because we're not overwhelmed with too many cats in our care, we're not overwhelmed with euthanizing more cats than we can find homes for, we might be able to invest resources in helping those friends, relatives who are needing to get rid of their own cat to do that in a responsible way, in helping those people that adopt a stray cat off the street to get it sterilized and vaccinated and identified. So we can do better for all the cats in the community that are getting rehomed when we aren't overwhelmed in our own systems. Likewise, we do not own most of the pie for reuniting lost cats with their owners. These are studies that were done in the United States, but multiple studies have documented that cats are more than 10 times as likely to be reunited with their families by a non-shelter means than by a call or visit to a shelter. And that's reflected in the relatively low reclaim rates for cats that we see in shelters. And it's also based on just the nature both of cats and our relationship with cats. By contrast, about 3/4 of dogs that are reunited with their families are reunited with a call or visit to a shelter. So when a dog goes missing, we definitely notice. It was right here, and now it's gone. When a cat goes missing, oftentimes it's a few days before we're really sure that the cat is actually gone. And it's maybe a few days or even a few weeks before the cat surfaces to go to a shelter. By that time, the person may have stopped looking for the cat. It may not even occur to someone who loosely owns a cat, who feeds a cat and likes a cat, that when that cat disappears, they should go to a shelter and look for it. By the time they do, if they ever do, it may be too late. At best, that cat may be adopted to a new home. At worst, that cat may have been euthanized. So again, when we're spending less resources on being overwhelmed in shelters, we can do a better job at helping cats to be reunited with their owners outside of the shelter system where most of that reunification happens. We can educate people who have lost their cats about the methods to find them. When people call and have found cats, we can tell them how to make signs and post them. We can post found cats on shelter websites, and we can facilitate that process more effectively than we can by bringing unidentified cats into the shelter and just holding on to them, hoping their owner will come. And then this is really the final big limit on our superpowers. When I was an animal control officer and I was bringing cats in and hoping that I was going to protect wildlife from predation by cats by doing that, hoping that I would protect cats from harm, hoping that I would protect public health by reducing the number of cats running around in our community, I had no sense really of what I was up against. This is a success story about one of the largest cat eradication programs that has ever been performed. This was on a subantarctic island. You can see a picture of it here. It was a rough environment. It wasn't a particularly hospitable place. And they started out with just about 2,500 to 3,000 cats. Those were the offspring of 4 original intact cats that were brought there to keep the lighthouse keeper company. This is an 11 by 7 mile island, so large on the scale of cat eradication projects, but small when you think about the size of communities that we each work in. There were some ground-dwelling petrels that were at risk, and so it was really important to eradicate cats in order to protect that species, and so a big investment was made here. Started by trapping 96 cats, infecting them with panleukopenia, and then releasing them across the island by helicopter. That wiped out about 50% of the cats on the island, and not humanely. But wiping out 50% when you didn't remove the food source, and you still have 1,200 to 1,500 cats remaining, of course didn't solve the problem. Those cats quickly repopulated the island. So then they brought in 8 full-time teams of 2 hunters, hunting day and night for over 14,000 hunting hours. That still wasn't enough. They brought in 5 full-time teams of 2 trappers running 500 lethal traps for 5 years. That still wasn't enough. They injected poison into 30,000 one-day-old chicks and distributed them by helicopter across the island. And finally, after 14 years, cats were eliminated from the island. Here's the reality. On the continental North America, it will never happen. We will never remove enough cats to substantially reduce the free-roaming cat population. And if we don't eradicate them and we don't remove the food source, they will repopulate to the carrying capacity of the environment. So that removal is not benefiting wildlife, is not benefiting public health, is not benefiting feline population control. You might think you've got an edge in Canada, But there's no apparent relationship between estimates of feral cat abundance and latitude or January temperature in southern Canada. And here's the glorious and terrible thing about cats. They are survivors. They have adapted to every climate and every environment, from hot to cold, from wet to dry, from urban to rural. They have adapted to every environment except, in some cases, to the shelter environment that we have traditionally and historically been able to provide in North America. But we can take that adaptation of cats and actually turn the situation for cats in shelters on its head by using that to our advantage, by recognizing that they can be okay in the community, in the environment, if we use our resources to support making that possible. If it's not helping to euthanize healthy cats, we can stop. If it's not helping to bring one more cat into a shelter, then we can comfortably care for, whether it's in a cage or in an overcrowded group room, we can stop that too. And we can do something dramatically different. And I was reading, just as I was starting to think about these ideas and seeing some exciting new programs being developed that ultimately went into the Million Cat Challenge, I read this book, and the title is How to Change When Change is Hard. And that really spoke to me, because that's what we're trying to do in shelters, is change things when change is hard. And it described a campaign that came out of the human health care field. And it was a campaign to reduce health care associated mistakes that led to harm and death. And the goal of the campaign was to reduce health care mistake associated deaths by 100,000 lives. And the way they did this was 6 evidence-based, practical, field-tested initiatives with voluntary declaration of participation by hospitals. And that was really important, because you can imagine, as a hospital administrator, it's hard to acknowledge, hey, we are making mistakes that are maybe resulting in needless deaths of human beings, of our patients, or we're not implementing procedures that would potentially save lives. But by all coming together and saying, we're going to do this together, we're going to change this together, no one hospital had to be singled out. By using field-tested and evidence-based initiatives, they made sure that it was actually practical. And this is just an example of one of the presentations that came out of it about adapting the campaign to a rural critical access hospital, so hospitals of every size and type. And what it ultimately formed was a peer-to-peer support group for healthcare improvement. And the book actually likened it to Alcoholics Anonymous. You come together, you admit that you have a problem that you're trying to solve, and then you support each other in solving it. And their goal was an 18-month reduction in healthcare-associated lives lost compared to the pre-campaign baseline. They had over 2,000 hospitals sign up, and they saved 122,300 lives compared to baseline over an 18-month period. So Julia Levy and I took a look at that and thought there could be a parallel in animal sheltering. This is really well adapted to the situation that we are dealing with cats and the challenges that we have. So it's built around 5 key initiatives: voluntary participation by shelters. We can beg, we can plead, we can send you temporary tattoos, but we don't have compensation to provide. We are trusting that the shelters themselves want this, want to make it happen, have the know-how to help each other move forward. And it's really built around sharing challenges, solutions, and success, a goal of getting many different kinds of shelters so that every shelter has someone to turn to who has dealt with a similar situation. And every time you learn something, you can share it with another shelter who could use that information. And the goal is a 5-year increase in lives saved compared to a baseline of 2012. The reason for selecting 2012 as the baseline year is that I first issued the 1,000 Cat Challenge in December of 2012, and then we issued the 100,000 cat challenge at the HSUS Animal Care Expo in Nashville, Tennessee in early 2013. So for shelters that already began implementing these initiatives, we wanted to give them credit for what they'd done in 2013. 2014 was the first year we started counting. So how did we choose the 5 key initiatives? We chose initiatives that balance the 3 points of what I think of as sort of the stool of successful sheltering, which is intake, care within the shelter, and outcomes. All of those things have to be in balance for a shelter to succeed. They are evidence-based and increasingly building evidence around them, but just as importantly, proven in a variety of contexts. As I said, big and small, urban and rural, private and public. And we chose initiatives that have variable resource requirements. Some of them are costly to implement, but some of them are free or will even cost less over time. And also that are flexible. They can be implemented just in part, just for 1 cat, or just for a pilot group of a dozen. They can be implemented gradually or all at once, full force. They can be implemented singly. They can build on each other, so one can make other ones more possible. They can be implemented in sequence, in conjunction, or not. So any one of the initiatives will have value, and all 5 may not be right for every shelter. This is a non-denominational campaign, so if you hate one of the initiatives but love 4 of them, you're welcome to participate. If only one of them makes sense, you're welcome to participate. These are the big 5, and you can see they sort of progress from before intake, could there be a better alternative? At the time of intake, deciding when the time is right to admit a cat to a shelter through managed admission, in the shelter with capacity for care, and then on the outcome side, removing adoption barriers or allowing a different outcome of return to field for healthy unowned cats. So now I'm going to take a little time to go through these one by one. As I said, I'm not going to get into the nitty-gritty of how to do it, but just to give you a feel for what they are. I should mention that you'll get a copy of these slides as a PDF. It'll be posted on the CFHS website. And these are live links, so you can go and explore more about each of these initiatives. But alternatives to intakes is this notion that instead of admitting a cat to a shelter, we could provide positive alternatives to either keep that cat in its home or in the community when admission to the shelter is not the best choice, either because we don't have the capacity to provide humane care or to assure an appropriate outcome for that cat. An alternative to intake does not mean just dropping the ball, just leaving people to fend for themselves, but it could vary from quite simple, providing educational material, referral to another organization, links to another website, as I said, posting a found cat or a cat that needs rehoming on your website, assistance with developing rehoming materials, providing finders with the wherewithal to foster an underage group of kittens instead of bringing them into the shelter if you don't have capacity to take care of them, to really helping them with behavioral resources, with medical resources, with food to keep the cat when they can't afford to take care of it. Whatever the issue is, providing spay, neuter, and vaccination services very often is helpful if someone has found a cat and they've decided to keep it or rehome it themselves. If someone is having behavioral problems or resource issues, getting the cat spayed and neutered can be helpful. And also if that cat does end up coming into the shelter later, then you're already 2 steps ahead of the game. Whatever you decide to do with alternatives to intake, do let other organizations in your community know, not to ask permission, but just to make them aware so that if you're saying it's best for this cat not to be brought into a shelter, it's not just getting dumped on someone else's doorstep when they don't expect it. And this is a really nice article about a shelter that really went all in providing alternatives to intake. And this is a quote from the director. We didn't limit admissions. We expanded our services that admission was no longer the only thing we offered. Remember, the vast majority of what happens for cats doesn't happen in shelters. It happens in the community. And so by investing more in not admitting cats, we serve the community better as well as making things better in the shelter. So here are some populations where you might consider alternatives to intake. For feral cats, when neutering them and returning them is not an option, and euthanasia is likely to be the outcome if they're admitted to the shelter. Maybe there's a TNR group that the person can be referred to instead. Maybe you can provide them with educational materials on how to coexist humanely with unowned cats. For healthy strays or owner surrenders, when admission would mean euthanasia or crowding, maybe you can offer them a way to find the owner of that cat, or a way to solve the problem that they're having with the cat, or rehome the cat themselves. And again, for underage kittens, when foster resources are not available, maybe you can provide them with the education and even the physical support, the KMR and the bottles to raise those kittens themselves and bring them to you later or rehome them themselves when they're old enough to be placed. One thing I think that's important about alternatives to intake is that just as we haven't asked permission from our communities to take cats into the shelter, we don't ask permission to provide alternatives to intake. We just offer the resources with the same conviction with which we've offered our other services. Basically, for any cat that would be better served through another organization or by staying where it is. Here's what it's not. It's not talk to the hand. Whoops. It's not refusing admission to sick, injured, orphaned, high-risk, dangerous, or abused cats. It's not just leaving the public to fend for themselves. It's not just foisting the problem off on another organization down the street. And most importantly, it's not all or nothing. If it feels like the right choice to bring a cat in because there's some special risk or the person is making threats and you believe them, then go ahead and admit the cat. It could be just one time during your busiest week of the summer. It could be just for a few cats. Or it could be a fairly widespread policy, but still empower staff to make exceptions. And then managed intake is sort of an extension of alternatives to intake. Maybe the answer is not no, but just not now. Now is not the right time to bring in this cat to the shelter. So managed admission is any form of scheduling intake to match the shelter's ability to ensure humane care and safe movement to the appropriate outcome for every cat. And it really could be any form of regulating intake to match resources, whether that's simple, like closing night drop boxes, or not picking up cats in the field, but just making sure that people take the time to bring the cat in. It might be restricting intake hours or days to match the shelter's needs. Perhaps you do a lot of processing for adoption towards the end of the week and the weekend, and so you take in cats at the beginning of the week so that they're ready to go for your big adoption time. Maybe it's a simple waiting list where people call, the shelter is full, put them on a waiting list. When you have room, you call them back and they can bring the cat back in. Or maybe it's fairly elaborate and you actually schedule appointments so that the admission of every cat is a thoughtful process on a designated day when you have time to sit down and get a little bit of information about that animal. Just like we're used to the idea of scheduling appointments for veterinary services so that we're sure that we have the appropriate resources to meet the needs of that cat. So it's all about when. It's not necessarily about who gets admitted to the shelter. Whatever you do, you want to combine it with alternatives to intake resources so that while people are waiting for their appointment or their time on the waiting list, they can also have an opportunity to help you by solving the problem themselves. Basically, it's about giving yourself a chance to know when the tidal wave is going to arrive so that you're prepared for it and you can take care of those cats appropriately. Like alternatives to intake, is not deferring admission for cats at immediate risk, and it's not limited intake. So in fact, shelters that have gone to a managed admission process, because they're able to be much more efficient and reduce the number of cats in care at the shelter at any one time, the cats stay healthier, they get a better reputation, they do more adoptions, and so they're able to take in more cats. Or intake could be decreased because better options were found, because while someone was waiting, they actually decided that they could handle that behavior problem, or they actually found the owner of that cat. So it could go down. It could be different cats. Maybe you find that owner surrenders decrease because people find some alternative to keep the cat, and you're able to transfer more cats in from outside partners. But as with alternatives to intake, it's not all or nothing. Somebody's house just burned down, and they need to bring in their cats, and there's no good alternative, then go ahead and take them in. And these are just the biggest surprises from sort of a combination of managed intake, managed admission, and alternatives to intake. And I think one of our big fears is that the public is going to freak out. We're going to see a lot of pushback. And there is some pushback, but over and over we heard this about every one of the initiatives of the Million Cat Challenge. The public got it a lot quicker than we did. They instantly understood the life-saving nature of managed admissions. The world didn't end. No one freaked out. No one got angry, but it's hard to argue with our results. People really understood the new policies and even told us what they were as they walked in the door. So when we present these with conviction, it's really surprising how well the community actually accepts it. And I love this one because I love to hear about URI being under control, because that means stress is under control and cats' well-being is being addressed. How easy it was, how fast my population of cats went down as a result. I had a garage full of cats stacked on top of each other, all being treated for URI, and within a month my garage was empty. And that was just a simple waiting list. It wasn't any kind of complicated process. That was an open intake public shelter, so they still took all cats that came. They just took them when they were ready. And then I love all the initiatives of the Million Cat Challenge, but I have to say capacity for care has a special place in my heart. So simple. Match the number of cats cared for at any one time with the capacity required to assure the 5 freedoms of animal welfare for every cat. So powerful to actually do this. We all know what the 5 freedoms of animal welfare are: freedom from hunger and thirst, discomfort, pain, injury, disease, freedom from fear and distress, and freedom to express normal behavior. But so often, the housing and the ability that we have to provide monitoring and daily care for cats prevents us from meeting those. Even if we're providing food and water, if the housing is so small that litter gets kicked into the food and water, then cats don't have freedom from hunger and thirst. If we have so many cats in a group room that the bully cats are constantly keeping the less dominant cats from jumping on the floor and accessing the food and litter boxes, we don't have freedom from fear and distress. If our staff is so overwhelmed that they can't monitor the cats, that they can't clean properly, we don't have freedom from disease. Good housing is the foundation of providing the 5 freedoms. For cats in particular in a shelter, they're so sensitive to the physical environment. And reducing length of stay is the key to improving the quality of housing and the quality of care we can offer to every cat without changing the number of cats we can serve over time. So if we can cut length of stay in half, we can give twice as much space and twice as much time to every cat without changing the number of cats we serve over time. It's independent of either intake or outcomes, so it doesn't mean taking in fewer cats. It doesn't mean releasing more cats alive, but it tends to make both better, because when things are better in the shelter, the whole system functions better. You have more time to keep cats out of the shelter, and you have more ability to get cats out of the shelter alive. This is what good housing looks like. Simple but powerful. The difference between inadequate floor space and adequate floor space has a tremendous impact on cat health and on shelter functioning. For singly housed cats, double compartment housing with at least about 9 square feet of floor space. For group housed cats, at least 18 square feet of floor space, in addition to whatever elevated space you have available. We've recently gotten manufactured the portal that you see on this slide. We're not totally sure about how it'll all work with shipment to Canada, but if you're interested in purchasing those portals or interested in more information about portalizing cages in general, feel free to email us at that email that's on the screen. And length of stay is the magic that makes it happen. Not going to get into that because that's a whole nother webinar, but the foundation is identify and stay within your magic number to maximize adoptions, and we have ways of easily calculating what that magic number is. Reduce stress and keep cats healthy to minimize the length of stay and present them well so they fly out the door and just repeat as necessary. Here's what capacity for care isn't. It isn't euthanizing more cats to make space for the ones that remain. It's not time limits. So we improve length of stay, we shorten length of stay by being more efficient, by removing barriers, and by keeping cats happy and healthy so they move out the door quickly. It's not about randomly euthanizing a cat because it stayed over its 2-week time limit or anything like that. And again, it's not all or nothing. Will there be times where you go over your capacity for care? Absolutely. You'll get a hoarding case, or your veterinarian will go on maternity leave and things will get a little backed up. But the important thing is to rapidly bring it back into balance. And again, the biggest surprise was how fast you see results. It's almost immediate, and that encourages the team to keep up with the changes. Now we can't even remember how we did it before C4C. Another quote from a different shelter manager, the biggest surprise was going from isolation being full all the time to isolation looking like this all the time. And that is a beautiful sight. I had to show this because it's timely. This is a quote from Christy Brooks at the cat adoption team of Portland, Oregon. It worked, and our cats are so happy. We all wanted it to work, but we didn't know how it was all going to happen. We have fewer cats on site, more adoptions, and our cats are so much happier. And just as I was finishing up this slideshow yesterday evening, I looked on the Society of Animal Welfare Administrators listserv, and I just happened to see this email about a year later from Christy Brooks to the SAWA listserv, saying, anyone want to send us cats or kittens? This is not a cruel joke. It is the real deal. We are looking for transport partners who have young cats and kittens who are healthy and friendly to transport to us. So not only were they able to portalize their cages and provide cats with twice as much space and twice as much time per day of staff time because they had half as many cats in their care, but now they're actually able to bring in more cats from transfer partners. And that's the magic of C4C. Not only does it make things better in the shelter itself, but it improves your ability to reach out. So a quote from Wendy Davies of the South Peace branch of the BCS PCA, long-term C4C has allowed us to save more lives. Live release improved from 53% to 92%. Stress-related issues are very rare. We no longer see URI in the shelter. We also spend significantly less on euthanasia and treating stress-induced illness, allowing for the funding to provide medical care and surgery we previously could not afford. So, talked about regulating intake and creating capacity for care. And now, what about the other end of the equation, getting cats out the door? So the next part of the initiative is removing adoption barriers, which is expanding the pool of adopters by removing barriers to adoption such as price, process, or location. That means taking advantage of off-site adoption opportunities, making it easier, removing barriers such as long applications or onerous requirements, or sometimes just lowering the price to make it affordable for people who are going to get cats anyway. So that's the basis of removing adoption barriers. It's just acknowledging to ourselves that people who want cats are going to get cats. The more we're worried about their ability to take care of a cat, we think they might not be able to afford veterinary services, or they might not be the most responsible cat owners, all the more important that we make sure that in those homes we place a sterilized, vaccinated cat with a microchip and a collar and an ID tag, and we build a relationship with those adopters who are most at risk by creating a positive interaction with the shelter so that if they do run into trouble, they know they can turn to us. And remember, it's not the end of the world if it doesn't work out. They take a cat home, and it turns out they didn't have their landlord's permission, and they bring it back in a week. Well, it's not the end of the world. It's like the cat went to foster care for a week. They learned a little something. Maybe you learned a little something about that cat's behavior in the home, and the cat got a little time out of the shelter and out of a cage. Remember that adoption fees, if they are leading to an increased length of stay or to some cats not getting adopted because there are potential adopters in the community who aren't coming because they can't afford the fees, those people are getting intact cats for free and bringing you their kittens, and you are incurring the cost of an increased length of stay. And that creates costs for daily care. It creates costs associated with illness as well as lower morale for staff and volunteers. So if you're relying on fees for income, find another way to decrease your daily costs so that you don't need as much income, or find another way to increase your income through donations or fundraisers or sponsorships for adoption fees. But don't hold cats hostage to a high adoption fee when lives are at stake. And understand that crowding means lives at stake as much as cats just not being adopted. Evaluate cats early to determine their adoptability. And if you see that this cat is already at risk for being some cat that's still going to be here in a month or two, or even in 3 weeks, go ahead and lower the fee, make it free, whatever you need to do to move it from the outset. You're still going to end up having to do that, but you'll save a lot of time and care and stress for the cat by promoting it early on in its shelter stay. And this is just a quote from the director of the shelter that I showed in the previous slide with the giant stacks of cats. Here, I'll just go back to that for a second. You can see cats in every one of these little cages, cats even in these crates up on top of the cages. That took a ton of time to clean. It was depressing to go in there. It didn't smell good. And here she emailed me later when we started to concentrate on the sense of urgency and how to get them into homes now, not hang on to them because we want, not need, but want to do just one more thing. It's amazing how many things are eliminated because they were never really necessary in the first place. So with our 200 cats mindset for the last 3 months, our cat count has been in the 40s and 50s. We are not euthanizing. We are adopting. A few things that removing barriers is not. It's not reckless. We're not just handing out cats to anybody who walks in. We are obtaining identification and basic contact information. So someone who really wants to abuse a cat is not likely to come in and present their identification and sign some forms with their contact information. And we're having conversations to match people with the right animal and give them the information that they want and need. And if we're worried, we can always invest our resources in providing helpful follow-up instead of creating barriers at the front end. Again, it's not all or nothing. Empower your staff to trust their instincts, but also remember that every time we deny an adoption, we are sending someone out to get a cat from somewhere else in the community of an unknown status and without our ability to follow up. And then finally we come to return to field. Probably the newest of the programs, even though the concepts behind it of having outdoor cats out and about, sterilized and living their lives in the community is certainly not a novel one. So return to field is sterilizing, vaccinating, and returning healthy, unowned cats to their location of origin as an alternative to euthanasia. What is return to field? It targets healthy cats that are brought to the shelter. So it's not going and collecting cats that are out and about the community, part of colonies, or being fed, sterilizing them and returning them. That's trap, neuter, return, also a really important program, but this one really is shelter-directed specifically. Sterilize, vaccinate, and ear-tip the cat, and return the cat to where it was already thriving. And it really addresses the impracticality I spoke of earlier of sheltering or eradicating all cats. This graph shows the blue bars are outdoor pet cats in Canada, outdoor community cats in Canada. The green bar is cats impounded and released alive, and that little red nubbin is cats impounded and euthanized. So again, we see if we replaced euthanasia with return to field, we would not be adding a meaningful number of outdoor cats to the overall population, but we would be revolutionizing what it is like to work in an animal shelter that previously was in a position of having to euthanize feral or shy, unowned cats that they were unable to place. Return to field is not relocation of cats. That's really important. It's putting them back to the place or near the place where they were found, where their body condition tells us they had access to a food source, where the fact that they were brought into the shelter alive and doing all right means they had access to adequate shelter wherever they were. It's not abandonment of cats to take them in, provide them with care, and then put them back to where they were thriving. And it's not turning away sick and injured cats, nor is it giving up on placing socialized cats into homes. So if we can find a home, by all means, let's find a home. But if we have one more cat than we can find homes for, and that cat is healthy and was doing fine where it was, and it wasn't an owner-surrendered cat, let's just put it back where it came from. So as I said, this is for healthy cats. For stray or unowned cats, we're not going to take people's owner-surrendered cats and have them show up again in their backyard a couple of days later. For adults and older kittens, and a lot of shelters have a guideline around 12 weeks of age because that's the age where we can give a rabies vaccination to have it officially count. And then behavior depending on the shelter's adoption and transfer capacity. For some shelters, it's only feral cats because they can find homes for all the social cats that come their way. But for other shelters that aren't finding homes for all the social cats that come their way, it might also be for the less social, the less adoptable of the unowned healthy cats that come in, because socialization status doesn't affect their ability to adapt in the environment. And why punish a social cat with euthanasia or with long-term confinement in a shelter that doesn't have the capacity to provide humane care when it could return to the place where it was already adapted? So focus on fate's better than death. And we don't return cats to places where there's imminent danger or environmental concern. If it's a wildlife habitat or it's a warehouse that's about to be torn down or some other reason why there's a clear and present danger to the cats, then of course that's one of those things where it's not all or nothing and we don't return the cat to that location. And what about this? What about the risk posed by cats to wildlife, the risk posed by cats to public health, rabies, toxoplasmosis, roundworm, hookworm, predation, all the things that we hear about and that we genuinely worry about. We are concerned about those things. Well, for one thing, we remember this. We remember that euthanizing a small fraction of cats without changing the amount of resources, their carrying capacity of the environment, is not effective anyway. But actually, return to field can specifically be more effective than removing cats. And I'm going to show you why with some quick slides. And I realize that's a picture of the United States because I don't have data on how many people feed cats they don't own in Canada. But I will say that's an aggregate of about 8 studies in the United States that show, depending on region of the United States, between about 1 in 4 and 1 in 12 people feed cats they don't own. So this is a common activity. And we know this. People like cats. They like to feed cats. Some people feed cats and they don't even realize it. But one thing that we do know is that litter-bearing mammals will have larger litters and higher survival of the young when there's more food available. This is what makes it so difficult and problematic, for instance, to control coyotes or rabbits. If you remove one member of the breeding population, but you don't remove the food source, there are remaining members of the breeding population who will have larger litters and repopulate right back up to carrying capacity. So there's a saying in coyote control circles, if you kill one coyote, 2 will come to its funeral. And the same seems to be true of cats. So imagine this situation where, let's just say, 1 bowl of food means each cat can have 1 kitten. And someone is putting out 6 bowls of food, and there's 3 intact female cats in the alley behind her house. And so they can have 6 kittens. Each of those cats can get rabies and transmit rabies because they're not vaccinated. Each of those kittens can transmit rabies and toxoplasmosis, which is something that cats get early in life and shed and can transmit for only about 2 weeks before they're immune for their lifetime. So let's say we're worried about this situation, and so we remove 1 cat. Either we take her to a shelter and relocate her, or rehome her, or we euthanize her. Did that just reduce the risk by 1/3? No, because what happens? She's not there to eat the food, but the person who was feeding her didn't know that we took her and took her to a shelter and put her somewhere else. So she still puts out 6 bowls of food, and these 2 cats who remain just get an extra bowl of food each, and so they have an extra kitten. It doesn't work exactly like that. I'm just using this as an illustration, but you'll see that the results of these programs are strikingly similar to what this would predict. So we've done almost nothing to reduce the risk posed by these cats, to lower the risk of rabies, or to reduce the risk of toxoplasmosis, or to lower the number of kittens coming into the shelter next summer. So what if instead, whoops, you almost missed that animation. What if instead we sterilized her, tipped her ear, and returned her? Now she keeps eating the food. We don't necessarily even know where that food is, but the fact that she came into the shelter in good body condition tells us there's food somewhere. We're going to send her out as our little missionary to keep eating that food, to lower the carrying capacity of that environment for other cats, but not be able to reproduce herself. And so now next season, those 2 other cats still only have 2 kittens apiece. Now all of a sudden, next summer, we have 4 kittens coming into the shelter instead of 6. We have 4 kittens worth of risk of toxoplasmosis instead of 6. So we have reduced the risk to public health. We have reduced the risk of wildlife predation. We have reduced the ongoing burden on the shelter to improve our ability to do other things. That's the model. Here's how it played out. At one shelter that started their return to field program in 2009, cats picked up dead on the road, down by 20%. So evidence that there are fewer cats out and about at risk in that community, and that was the only thing they really changed during this time. Intake for both cats and kittens, down almost 30%, reduced by almost 1/3, just as that model would predict. Euthanasia down by 75%, euthanasia due to URI down by over 99%. Wow. Here are some quotes from directors about what their biggest surprise, and again, you see the same things. People who turn in cats want them back. They even get mad if the shelter adopts them out. Closet feeders started calling the day after the ordinance approving this practice passed. So we have a better ability to have dialogue with people who are already feeding cats in the community so we can teach them ways to do it more responsibly. Lack of complaints from the public, and how many other communities are calling to find out how to do similar programs. And this was my favorite quote. Once we fully implemented our program, the only real regret we had was that we didn't do it sooner. So don't wait. Do something today. Figure out what initiative is right for you, where you're at, how you can improve, or if you're right where you want to be, join the Million Cat Challenge so that you can help other shelters reach the same goals. All of you can join if you have a physical shelter facility and you're working with one or more of the 5 key initiatives to reduce euthanasia or increase slave release or provide capacity for care. And one cat counts. This is about the quality, it's about the action, not about the numbers. You're as valued if you're going to save one more cat or if you're going to save 8,000 more cats. This is the way we're actually counting to 1 million, and this again is modeled off the 100,000 Lives campaign. So shelters will report their actual data for 2012 and their estimates for the year of enrollment for live intake, euthanasia, and live release. So if you took in 1,000 cats in 2012 and you hope that you'll provide alternatives to intake for 100, maybe you'll estimate that this year you're going to take in 900 cats. If you euthanized 100 cats in 2012 and now you think you're going to return 10 to the field, maybe you estimate that this year you'll euthanize 90 cats. Whatever you estimate, it's fine because we'll collect the actual data and update the numbers once the year has concluded. We'll update the numbers annually, and then we do the math. And we'll count one number. If you reduced euthanasia by a combination of decreased intake and increased live release, then we'll count the reduction in euthanasia. Because, for instance, if a shelter euthanized 100 cats, and then the next year they took in 10 fewer and released 10 more alive, so they only euthanized 80, we would only count 20 towards the million lives saved. If a shelter only increased their live release and didn't decrease euthanasia because they already weren't euthanizing any cats for whom that wasn't really the right outcome, then we'll just count the increase in live release. But we'll only count one number. We won't double count. So we won't count increase in live release and decrease in euthanasia that was accomplished by adopting out or returning to the field more cats. Hope that makes sense. That's a little hard to explain. No individual shelter will be made public. Only aggregate data will be reported. So I've actually finished just about on time. I'm hoping that we can count you in. This is the map. I think it was early yesterday, so there may be a few more shelters that have even joined up since yesterday morning. But even though the number of shelters from Canada is lower than the number of shelters in the United States, if we could have the percentage of shelters participating, just knock it out of the park, that would be an incredible way to lead the way for all of North America. So I hope we can count you in. I hope you'll sign up today at millioncatchallenge.org. You can see the link for a shelter registration form. You can always email info@millioncatchallenge.org if you have any questions at all. And thank you so much. And I'm happy to stay and answer questions. I really appreciate your time and attention today.
Well, thank you so much, Kate, for that very informative presentation. As Dr. Hurley said, we can take some questions, so you can just go ahead and enter those into the question box, and I'll read them out. But I also just want to let everyone know that if you'd like to hear some more from Dr. Hurley, that she'll be at the CFHS National Animal Welfare Conference that we're hosting in May in Richmond, BC, and she'll be speaking about capacity for care in shelters. So it would be great to see everyone there as well.
Yes, it would.
Sorry, go ahead.
It would be great to see you all there.
So we don't have any questions just yet. So if you do have one, don't be shy. Send that over here. We definitely have a few minutes to answer. Okay. All right, so Craig just wanted to thank Kate, and the BC SPCA will be joining the Million Cat Challenge.
Woohoo!
All 36 shelters.
Awesome. That's going to put a few more pins on the map.
All right, so where do you stand on single cat adoptions? My adoption team believes kittens need to be adopted in pairs.
That's so funny because my adoption team, when I first started working at a shelter, prohibited pair adoptions. And so I think that's just a great illustration of the things we think are absolute. There is someone else who thinks the exact opposite. So we thought if you adopt out 2 kittens, they will socialize with each other. You will never bond with them. You are not allowed to have 2 kittens. The reality is, if someone wants a single cat, they will get a single cat. They won't get it from you. They won't get it spayed and neutered. They won't get it vaccinated, and it will end up in your shelter to be placed as a pair. That's one thing. The other thing is that people have cats and succeed with cats, and cats thrive in all different kinds of ways, in all different kinds of homes, in indoor homes, in outdoor homes, in indoor-outdoor homes, with other pets, without other pets. We can't control what happens to cats. We can control the education that people receive when they get a cat. So if they want a single cat, then we can talk to them, if that's our policy of openness, about how to make sure that that cat has enrichment and fun and toys and play. And if they adopt a pair of kittens, we can talk to them about how to make sure they interact with each cat individually and give each cat some time alone so that they connect with the cat as a human as well as the cats connecting to each other.
Thank you, Kate. Is there any more questions that anyone has right now? I'll just give everyone a couple more minutes to send them in if they have any. But it seems you must have done a great job of addressing everyone's questions ahead of time, so that's a plus. We just got a big thank you from one of our attendees as well.
Awesome, and you can always email info@millioncatchallenge.org if you have any questions that come to you later, either about participating in the challenge or about any of the initiatives.
And as soon as we get the recorded webinar up on the website, we will send everybody the presentations, the link to the CFHS website, and the email from Dr. Hurley, so that if you do want to get in touch with her directly, you can.
Fantastic. Look forward to seeing some new registrations soon.
Excellent. Okay, well, I think maybe we'll wrap it up.
Yeah, it looks like that's all the questions for now. So yes, again, thank you so much, Dr. Hurley, for that presentation, and we're looking forward to getting some more participants in the Million Cat Challenge and hopefully seeing everyone in Richmond later this year.
All right. Have a great day, everybody.
Good afternoon.